the provider will tell them that this is a viral infection and antibiotics will not work against viral infection, so go home and rest. But can you think of a time that there's a viral infection that would not improve with simply going home and resting? Influenza or the flu can cause a 10+ day fever, sore throat, aches. You've probably had influenza. Well, there is a medication, an antiviral medication called Romantadine that could be offered if it's caught within the first 48 hours. Another infection that you may have heard of, another viral infection, is shingles or herpes zoster. This virus can cause severe pain and complications, especially in the elderly. So we may offer an antiviral medication for shingles called acyclovir. HIV, as you know, is a very serious viral infection. In the movie Bohemian Rhapsody, Freddie Mercury was diagnosed with HIV and loses his battle very shortly after diagnosis. Well, luckily, HIV is no longer the death sentence that it once was. We have lots of different HIV medications now, and patients are put on a combination of these medications. So in this module, we will be reviewing 5 of the classifications of the HIV medications. You will want to watch this video, HIV medications, to see how these different medications attack HIV. The other group of drugs that we will be studying in this module are the antifungal medications. These medications may be familiar to you too. Many young men may get athlete's foot, young women may get yeast infections or candida. The infections are treated with antifungal medications, clotrimazole or fluconazole, or as we call them, the classification, the azoles, ending in the suffix azole, azoles. Now, very serious fungal infections that invade the lungs and can potentially be life-threatening may be treated with a strong antifungal medication called amphotericin B, which a lot of people call amphoterrible because it has the potential to cause severe side effects. So we'll be studying these medications during this module. Now, when you're studying, remember to think like a nurse and think about the different things that you will need to know when administering these medications. First, the action. What does this medication do? How does it work? Next, the adverse reactions, what you may not want to see but are expected. Some of the interactions, when they interact with food, if they interact with different drugs, you need to know that as well. What effect might they have on lab tests? Will they affect the bone marrow? Will they cause the patient to be more susceptible to infections? What are the contraindications and cautions? When don't you want to give this medication? Or what do you have to be very careful about before giving this medication? What about pregnancy? Are these medications safe to give to a pregnant patient or a breastfeeding patient? And then lastly, nursing considerations about this medication and patient teaching. Remember to utilize all of the resources within the module and have a great week.